Good evening, everyone, and welcome to Pause for the Truth. What a wonderful day it is in Florida. OMG, it was so cold the past weekend. Dr. Kane, I thought I was up north. How about you?
Well, I didn't think I was up north, but I happen to like the cold as I've
Amen.
told you before. I can put on as many clothes as I want to. I just can't take off that many. So, yeah, I'd rather just go on ahead and stay comfortable and put on more clothes and keep everybody happy.
No, sir. Actually, I didn't choose Florida. My parents chose Florida, but I have chosen to stay in Florida because
Yeah.
I like our weather. But anyway, nonetheless, we are so pleased tonight to have a very important discussion. It's a topic that many of us probably hadn't thought about, but as Dr. Kane and I were talking about what should we discuss tonight, and quite frankly, we talked about that other virus, right? Is that
Many
virus
things.
that, I mean, you know what I mean? That lately COVID-19 has taken over. It's consumed all of us in terms of being at the forefront of what we all are preoccupied with, trying to protect ourselves from it. However, we thought it was important to simply talk about, is HIV still affecting our community? It's just that simple. And tonight we have some very distinguished guests among us. I'd like to welcome Dr. Dory Russ with the AIDS. I'm going to botch it, Dr. Russ. Help me out, please. I'm sorry.
AIDS Healthcare Foundation.
I started to say that, but I was like, that didn't sound right. It sounded like it was too right to how you doing this evening, Dr. Russ?
I'm well. How are you, my dear?
Doing absolutely wonderful. Thank you.
Good, good.
Also joining us is my good buddy and former colleague, Rod L. Brown. How are you doing, Rod? Rod,
Unmute
you're on
yourself.
mute.
All right. I'm doing very well. It's good to see you all.
Good to see you. And as some say, it's good to be seen, right?
Yes, indeed.
In
Yes,
light
indeed.
of all that's going on in the world. So we're just going to have a conversation tonight. And as always, to those who are watching or listening, please log on to our website and post questions of our guests, and just anything that you've thought about or you hear rather based on the conversation that we're having tonight. Dr. Kane, I'm sorry, I've been doing all the chitter chattering. Is there anything you'd like to say as we start the conversation?
Not really, other than I'm happy to have the two panelists that we have. I think we couldn't ask for much better in terms of people that are aware of what's going on in the community and as it relates to our subject matter from different aspects of, in terms of providing care, both from the medicinal aspect or pharmacological aspect, and then the other part of providing care is just helping people, knowing people, providing the psychological needs and social network needs that those individuals have, regardless of what the disease state is, but especially as it relates to HIV, because that is throughout the years that I've dealt with HIV in my practice and in the community. That has been one of the things that it was very difficult in terms of taking care of those patients, not because of the patients, but because of the community and the things, the false narrative that were out there about HIV. But I'm sure our guests are going to be a lot better at enlightening us about those false narratives and what needs to be done and what can be done than I am. So let's roll.
So thank you, Dr. Kane. So Dr. Russ, I just have to start out by simply asking the question that we have for our topic tonight. Is HIV still affecting our community? I'm sorry.
App, Absolutely. Unfortunately, I have people born in the 2000s that I diagnose every day with HIV. It's definitely a different virus than it was 40 years ago. It's not a death sentence, but it is a disease that is still prevalent in our community.
Wait a minute. Let me back up, Dr. Russ. You slid that out very eloquently. Did you say people born in the 2000s you
Doesn't it make
diagnosed?
you feel some kind of way?
Because it's only 2022, so
Mm,
really?
mm, yeah.
Well, let me say, I have to
Wow.
interrupt. I took care of the very first, my residency happened to have come along at a time that I took care of the very first two HIV patients here in Duval County. I did not make the diagnosis of the first one, uh, but I assisted in the diagnosis of the second one. And obviously, it was not called HIV at that time. I know I'm dating myself when you start talking. She said 40 years. I went like, whoa. Yeah. But and I know I'm dating myself, but it was at the old University Hospital, and it was quite an experience in terms of what we were dealing with and the thought processes of people. But that's another story.
Yeah, I mean, it's just, and when you talk about dating yourself, having worked at the health department, I was around when we hired the first person over who was and I'm not going to say his name because I don't know what's happening with him now, but I remember him very clearly and vividly because first of all he has such a great personality, but the first person. And Dr. Russ, I remember back in the day when the AIDS epidemic first started, it was associated with men, gay white men in particular. And I also know over the years it's evolved. And meaning that the people who were being infected the most, quite frankly, look like all of us on this panel. They were primarily African American. Is that still the case today?
It is. When you add in the social determinants of health, it's not just a matter of who's being diagnosed with HIV, it's who's having better outcomes. Um, and so our gay white male population is able to come, for the most part, get their medication and go. When you add in all the psychosocial factors that members of our community face, sometimes it's a different story.
What do you mean by that? Like,
Um, So some of the medications require food, which probably everybody on this panel takes for
oh,
granted. But not everyone has food security, so that alters what medications are available. It's a very much interdisciplinary approach. I love the way we were talking about the social needs of the patient. If you have transportation issues and can't get your labs done and can't get to your appointments, then you may not qualify for some government programs that help facilitate access to care.
wow. Wow, Dr. Kane, isn't that something? And you hope that as people are listening, that they're thinking like, what can I do to help? Right. And so hopefully as we continue the discussion. Now, Rod, I want to pose a question to you. And Dr. Rush, you're not off the hook. I'm coming back to you. I'm gonna give you a little breather. So Rod, you know, I can recall back in the day when you were at the health department,
Mhm.
you were all over the place trying to educate people and make sure that they understood the risk. Was that a hard job, Rod, trying to convince people that you are at risk for contracting the virus?
It was a very hard job. I think, first of all, it was the misconception, as you stated. In the beginning, this was thought to be a gay white man's disease and that people of color and women weren't being affected. That misinformation that got out of there, because it was the earliest information, first of all, it was that those were the ones that were showing up to be treated. Those were the ones that were showing up for care because they had access to care. Again, it goes back to access. And so that misinformation got out of there. And then um, people tend to believe what they heard and never got educated. So when you try to educate them, first question with me, I'll tell you, the first question that was asked is, first of all, oh, are you gay? Or do you have AIDS? Because there's that stigma out there, because it's like, why else would you be out here trying to tell me about HIV and AIDS? So stigma was a bigger problem. Misinformation is a big problem, was and still is, actually. So yeah, it was a hard game. First of all, in our community, because we had one of the biggest voices in the Black community is the Black churches. And that was a major stumbling block because it wasn't approached. It was approached as a religious or a moral thing, and not a community health crisis. And I think that was one of the biggest misconceptions, and that's what led to, as Dr. Russ says, people in the 2000s that are still being affected today, because some people still think it doesn't affect me, or I'm not gay, or that's not a factor for me. And then those too many of us suffer in silence, because it's like we have people that know their status, but instead of standing up, they go in the corner and they just withdraw because they're afraid of what people are going to say about them, what they're going to think about them, or what they're going to think about their family. So yeah, it's hard then and it's still hard now. I've been retired a year, but it's still 30 years later, it's still the same thing.
Let me chime in because again, I'm the dinosaur. I am the dinosaur. I really connect with that, and this is not one of those things where it's a pat on the back, but I do recall back when it first came out, the fear that was in the community in terms of people who were HIV positive, the misconceptions and misinformation that were put out. It was so bad till people were gowning up just to enter into an HIV patient's room. I almost got fired over at University Hospital because I refused to submit to the thought process that it was a gay disease, because it made absolutely no sense to me. It's a logical approach to it made no sense. Right. I mean, when I started talking about, this was one of our professors started talking about fisting and all that kind of stuff. Rough. I mean, it was so crazy what he was saying. I'm going, that makes no sense. And then just to add even more fuel to the fire of this misconceptions of things and perceptions. I remember when the National Medical Association, as member of the National Medical Association, how we had to write Oprah Winfrey when she started making the influences of Download Brothers being the primary cause of this. We had to stop her on a dime. It was such a loud outcry from the Black physicians that it zipped it in the butt. It looked like as soon as we were getting ground right in terms of understanding that this was not a gay disease, we really had to step back and put up our dukes and go after Oprah from that standpoint. And one last thing, you mentioned the Black churches, and I can tell you how many times I tried to get into those churches back in those days, talk about HIV. They were happy to see me coming until they found out my subject matter.
That's right.
Then all of a sudden there was this excuse and that excuse. And so I just started calling them out. It's like, you're not doing, your community any services about, this gay bashing and fear that you're incorrectly presenting to our community. You're killing us. Because if you think that that's what it's about, you're allowing these lies and this misinformation to perpetuate the disease in our community. And until you grasp and take responsibility of making sure this message get out, you're going to continue to allow HIV to kill people. That's one
thing that Dr. Russ said at the beginning, that she's diagnosed people who were born in the 2000s. And I am reminded years ago where a colleague shared that, and this was not anybody affiliated with the health department, so let me get that out there. This is somebody who lived in another state or whatever, shared about having told someone, a young lady who, she was a teenager at the time, told her that she tested positive and was pregnant, and she had only had one partner.
Yeah.
Oh, I can tell you.
So just put a pin in that for a minute. A young lady who had a boyfriend, thought, gave of herself, and then to find out, Dr. Russ, that not only was she expecting a baby, but she was HIV positive. So just imagine the emotional toll that placed on that teenager. So when you talk about the cases of people, the number of people you've diagnosed who were born in the 2000s, one thing that Rod said that was interesting, though, is how people it was politicized then.
Mhm.
People believe what they hear. What's the similar? Do we see some similarity here? You know, you think about COVID and how
COVID,
it
yeah.
was politicized and
Mhm.
how, you know, it was first put out there that it was older people getting COVID. Then the disease evolved. With HIV, it was gay white men getting
Mhm.
getting infected, and the disease evolved. So what do you say about that? I mean, just the fact, just to even wrap your head around that.
So I'll jump in. It's not even just the fact that when COVID first happened, it was older people. I don't know if anybody else was on social media, but I had plenty of my Black friends saying Black people can't get the Rona. Like that was
Absolutely.
the thing, is that
Mhm.
we thought we were immune. And I was
Mhm.
like, viruses don't care, y'all. Just be
Don't
careful.
Amen.
discriminate.
So you had, and then once we saw, there's any benefit to COVID, it's the fact that it shed light on health disparities that people in the field have known about for years, but it brought it to the
Mhm.
forefront. Definitely, there was the stigma associated with it. Well, how did you get COVID? What did you do? What did you? Well, how did you
Mhm.
break protocol? Um, I will say this: some of my long-term survivors with HIV said, "We beat one virus before. We're going to beat
You can
this
beat
one too."
another.
So
Yes.
they've been cheerleaders, and they have
Mhm.
such a level of frustration with how politicized, like you said, that this got. Again, they're like, we've been here before. We know that politics and science don't always mix.
Mhm.
Yeah, and I've been having a conversation, Dr. Russ and Rod, really about trust, because I think that that's what it's all about. People, for whatever reason, Dr. Russ, they might, Rod, they may have called you and even you, Dr. Kane, and trusted your opinion about something, about an
Mhm.
illness of some sort. But nowadays, it's just about trust. But we're not talking about COVID tonight. We'll talk about that next week. I really want to focus on what should people do to protect themselves. Has it changed? Or are you still supposed to do those things in terms of, let me break it down, Dr. Russ and Rod, what I recall over the years, my experience being a health educator in public health, it is that you, first of all, know your status,
Mhm.
that you do not engage in risky behavior.
Mhm.
You know about your partners,
Mhm.
and you try to be in a monogamous relationship, at least start out knowing each other's status, and hope that you have someone that you're in a monogamous relationship with. What did I leave out? I know I left something out.
No, I think you said it well because first of all, I think, and I say this to young people especially, if you can't talk about sex, you shouldn't be having it. That's number one. Okay, that's number one. Number two is that it doesn't matter, just like anything else. One time is all it takes. And the fact is, the only thing you can protect is you. Okay. So I think first of all is education. Number one, you have to know your status and then be able to talk about it so that you can talk to your partners. Because if you can't have the conversation, you shouldn't be doing anything. And then of course, you can't trust. I may tell you, oh well, I've heard this a lot too. Well, I'm clean. Well, I don't know what that means. I'm clean. I bathed this morning also. How about you? So that doesn't mean anything to me. So it's like, let's have a real conversation because when you think about it, when you have unprotected sex with one person, you having it with everyone they've been with. And sometimes that person may be infected and not know it. So it's about having a conversation and say, if we want to take that step, I would suggest, well, let's go be tested. And I've said this a number of times that when you talk to an individual and you say, well, let's go have an HIV test, and they're like, oh no, we don't need that. Maybe they're telling you something already. You got to listen to what's not being said. Because if you are confident in yourself and you know yourself, then why not why can't we just go be tested together and share our results? Okay.
One of the
So
things I just have to make sure I put out there,
mhm.
being a primary care physician, just to remind the audience, I take care of patients. Of course, my patient population, as I've said many times before, as I've gotten older, so have they. That doesn't exclude them from HIV.
That's
But
right.
He calls himself a
Yep.
geriatrician, or
yeah,
some
but I
ridiculous.
still take care of younger folks as well. We need to remind people that HIV is still a disease that killed over 700,000 people since 1981. We still need to remind folks that they can, as many as 38,000 a year get infected with HIV. Close to 40,000 people a year get infected with HIV. And then there's about a million people currently infected with HIV. Now, while those numbers seem small compared to COVID, they're big if it's you that get infected with HIV.
It
So
is.
it doesn't make a difference about all those other statistics when you're the one that's being affected by that particular disease. And in this case, HIV is still out there. We cannot ignore what it means. And also, just to point out to piggyback on what Rod was saying, and as well as Dr. Russ, know your status. And so, as a primary care physician, I usually, and Ms. Turner, you've heard me speak about this before. I tell my patients, let's get your green card up to date. And they ask me what it is. And it usually references STDs because STDs are like a gang. You see one gang member, you start looking for the rest.
There you go.
And so if you see chlamydia or gonorrhea, start looking for HIV because it may be just hiding in the shadows, okay, until you look for it. So my thing is knowing your status in HIV, knowing you and your partner's status
And your partners,
in HIV.
yes.
So when I say a green card and I ask them to check all these STDs and they get their report card more or less on these STDs, they need to look at their partner's report card, not verbally hear.
That's
They
right.
need to exchange the information. If you're going to have sex with someone and they're not going to go and provide you with the information of their STD status like you have done for yourself, then you need to move on. It's my message.
Absolutely.
I'd
Go ahead,
like
Dr.
to
Russ.
talk about a few more ways that we can prevent. So yes, what we talked about absolutely is the ground floor of what everyone should be doing. But then as you risk stratify and find out where your risk level is, there may be additional things you can do from a medical standpoint. So I'm going to talk about three things. We have PrEP, PEP, and U equals U. These are tools in the toolbox. They're not instead of, they're in addition to. So PrEP
Absolutely.
stands for pre-exposure prophylaxis. So this is medication that an HIV negative patient can take to prevent acquiring the disease through sexual activity. And then you have PEP, which means post-exposure prophylaxis. So if someone's had an encounter, a condom's broken, it was a wild weekend in whatever city of their choice, they can take medication up to 72 hours that helps to prevent acquiring the disease. And then we have U equals U or TAP, undetectable equals untransmittable, or treatment as prevention, which means that in the year 2022, we know that a person living with HIV who has a viral load that's virally suppressed or under 200 cannot transmit the virus as long as they remain on their medication. So that's why it's very important, your status, your partner's status. If your partner's positive, their CD4 count and their viral load as well, because those are all tools we have to prevent the transmission.
Dr. Russ, that was wonderful. But could you repeat that? Because I want to make sure. Could you mind repeating at least the first two options?
Yeah, and you got plenty of time. You don't have to rush through it.
I'm going to tell y'all, if in any category where I've given a speech, it's always been to slow down. So please tell me if I'm doing that because I don't hear it. All right, I'm going to try. So we have PrEP, which stands for pre-exposure prophylaxis. This is medication that an HIV negative person can take to prevent acquiring the virus. Then we have PEP, which stands for post-exposure prophylaxis, which is if somebody has had an encounter, a condom break, a new partner, they're not sure, a sexual assault. This is medication they can take after the effect for up to 72 hours that will reduce the chance of transmission. And then we also have undetectable equals untransmittable, also known as treatment as prevention, which allows us to remember that a patient living with HIV who has a viral load of under 200 cannot transmit the virus as long as they remain on medication. Was that better? I'm sorry.
Very
And
good.
those are some great options. But I like what you said though, Dr. Russ. These are just more tools in your toolbox. It doesn't
That's it.
replace the fact that you still need to
Mhm,
protect yourself. You need to know your status. You need to have the conversation. Rod, why do
mhm.
you think it's so hard for people to have a conversation about getting tested? They think you're going to try to scare the person away and they're not going to want them anymore?
I think so. Well, you know what? I'll tell you with some of the young people, it's been like this. The girls have been more aggressive than the boys in many cases, okay? Because there have been times when we've taught at the schools and the girls are trying to force the guys to have sex. And if they won't, they'll say, oh, you must be gay or something. You don't want none of this. So there's a lot of peer pressure uh, for having sex and starting sex early in the young people. Um, but of course, when it comes to testing, it's like it doesn't affect me. They don't see it as affecting them, and so they're not doing it. And we can see that in the numbers of youth that's still being affected. I was looking at some of the numbers in Florida. In 2019 alone, we had 6,489 new cases of HIV in Florida. In 2019, those are the most recent numbers we have. And that's ridiculous in this day and age with all the tools in our toolbox. We have so many tools in our toolbox. And even with those tools, we have to remember that still contraceptive condoms are still effective and it's still, you need to use condoms, regardless. Condoms is still, that's one of the best tools in our arsenal. And we
Right.
still need to use that.
You
So
know,
talking, I'm
go
sorry,
ahead.
go ahead.
No, you go ahead.
So when you talk about talking about being, first of all, we have some people that they'll take one test. And most times it's like right after a risky weekend or something, they come in and they want to get tested. And of course, that may be too soon to get an actual result. And then they won't come back again because they get that one negative and they run. Oh, I've got this and this is good. And they need to realize that that one result is just time limited. That is time limited. So it's not like that's a permanent one or an intention or a definite, or I'm negative and I don't have to go back. And we have to dispel those myths and all that to get them out and get them tested.
Well, what I want to make sure, and Dr. Russell, you can address this. I can state it, but I want you to address it. Rod spoke of time limitation in terms of those tests. And, by that meaning, if you go right out if you go and get tested after a weekend of frolicking at Disney World or wherever,
Super Bowl weekend, yeah,
that may be too soon to get that report back that is critical to having accuracy to it in terms of your status. Can you explain to people when do they need to be tested after an encounter where they may have had a misstep or I say misstep, but did not do the things that the people on this panel are recommending to do prior to having that encounter, and then what to do afterwards?
Absolutely. So one thing you're going to want to know is what type of test are you actually having? So there's an antibody test, which means the body has now recognized this virus and built up machinery against it. That you're going to want to wait for about 30 days. So some people will do that initial test and then come back 30 days later. There's also the viral load, which lets you know how much of the virus is actually circulating in the body. One of the things that I find fascinating, because I'm a nerd, about HIV is that it's kind of bimodal. So you'll have a peak of the viral load when you're first infected. It can be in the hundreds of thousands or the millions, and then it comes down. And then if you're on treatment, we get what we call undetectable, virally suppressed. We're at our goal. It'll stay down. If you, like Rod said, go in the corner and kind of act like it's not happening, over time, that number will start to go back up. So just to say again, you either need to have a viral load so you can see if the virus is circulating in the body, or an antibody test at the time of the encounter and 30 days after to confirm that it's still negative.
And then having that test at the time of an encounter, the main information is going to give you, and you can correct me if I'm mistaken, having it immediately after that encounter, if you're positive, it was not from that encounter, most likely.
That's exactly.
Already were positive.
Exactly.
So it may not be you
Mhm.
received an HIV infection, you may have
Mhm.
given it
You need to
to
make that
Yeah.
phone
someone.
call and let them
That's
Yeah.
know.
why you need to
Absolutely.
know your status before.
Yeah.
And I want to
Eh,
say this as well. In the state of Florida, there is a duty to disclose status
mm,
prior to starting a sexual
mhm.
relationship. So if you know that you are HIV positive before you start a new sexual relationship, you have to tell that new potential partner, or you may face prosecution of up to a third-degree felony. There's some issues in terms of advocacy about now that we know that undetectable equals untransmittable.
Mhm.
Should we still
Mhm.
have to do that? And what I tell my patients is, as long as the law says you need to tell them,
You
because
need
I
to.
want you to stay outside and on this side of the clinic, outside, you got to tell them, and then we can work on the back end later.
Well,
Dr.
Ron,
Russ, have
one of
you?
the things that I ran into a lot was exactly what Dr. Ross said, and Russ said. I'm sorry, and that is, I, in previous years, especially I'm talking 10, 15 years ago for sure, before maybe the state passed their laws, patients that were HIV positive would come to me and ask me how should they handle this because they ran into and they themselves were positive. I had one young lady one time that very nice young lady, and uh, the gentleman was very he was he was pursuing her. I mean, really pursuing her, and she didn't want to dispose of HIV status, so she was running away from him in terms of as far as so to keep from him knowing what was going on. She'd rather just not deal with him. Period. But he was such a nice guy. He was so persistent that she actually came to me and say, "Should I tell him what my status is?" Well, now at that time, Florida did not have that law, and so I had to respond. And in terms of there was two aspects to it: what's best for her, but also what's best for the community. And that was a very difficult decision on my part, but even more difficult on her part, being the person that had to divulge her secrets. So what would you say about that? Now, unmute
And,
yourself, Rod.
am I
You're
muted?
muted.
Okay, am I unmute now? Okay.
Yes.
Yes.
Yeah, I just wanted to add to that because in the early 90s, we used to do a thing when we started education was called who to tell, when to tell, and how to tell. Because one of the things is that once you put it out there, you can't take it back. And that's what made it hard about people disclosing because some people made the mistake of telling one person that they thought they can trust, and then everybody knew their status.
Right.
So, and again, I always encourage the individuals that I've talked to that everybody doesn't need to know. Not until you're comfortable with it. If you're not sleeping with them and all that, they may not need to know. But you
Right.
have to decide those that are in your chain of care, those that are close to you, those that you have to reach out and you have to feel people out before you put it out there. Because once you put it out there, you can't take it back. And I know of two cases where there was a suicide because of disclosing their status and someone took it and ran with it and the whole community knew about it. Okay. And that was a young lady and a young guy, and both committed suicide because of that. So that's another reason it's hard to have that conversation because sometimes the person you think you can trust is not the one you tell that to, you know.
Right.
And I hate to say this, but I had church folks that you thought you can trust, and they're the one that spread the news. Okay.
Yes.
So when you're talking about, and Dr. Russ, you're absolutely right. We know the law says you must, you should disclose that. And you should disclose it if you are intending to share needles or have sex with those individuals. And if you're not, the other individual may not need to know.
Right.
So you have to be very careful when you start disclosing your status.
Right. And I guess I mentioned that because
Mhm.
as a practitioner, we have practitioners listening to this broadcast. So I have to make sure that they are aware that there's sometimes some tough decisions that they
Decisions.
may have to make. Not as
Mhm.
tough as the individual,
Individual, yeah.
yeah, but there are still some tough decisions we have to make. And I just want to make sure that, they be very thoughtful in terms of when they give that advice. It has not been, what they say, an easy road to hope from that standpoint. Not to miss. Anyway,
What is that?
it has not been an easy road to hoe, and that you really need to be careful of what you tell your patients, what they
Hmm.
should and should not do, because
Absolutely.
the last thing you want is a suicide. I even remember cases
Hmm.
where there was misinformation given,
Hmm.
mistake, and
Hmm.
people committed suicide because they were advised that they were HIV positive. People told them over the phone. They did, stuff that should have been in person, and provided to that individual by the provider and not a nurse whom, and I know that may be archaic now, but I know how it happened back then. And people would give information to them or left it on their phones. This was very early on, left it on their phone about being positive for this, that, and the other. So I just want to make sure providers realize they need to be very careful with whom this information is shared with and how it is shared.
So I want to switch gears a moment because February 7th is National Black HIV/AIDS Awareness Day. It is a day that was marked in 1999 as a grassroots education effort to create awareness about HIV and AIDS prevention, care, and treatment in communities of color. And there are a few events coming up. And Dr. Russ, I'm going to start with you. Is to your knowledge, and I know you're on the care side of it. So if you don't know, I understand. They can always reach out to you. We can post it on our website and point people to your website. But to your knowledge, are there any events that you know of that are being planned in recognition of National Black HIV/AIDS Awareness Day?
I will have an answer for you by Thursday.
Well, good news. I have an answer already,
I
right?
knew
Awesome.
So on Wednesday, February 9th, at the FSCJ North Campus in the courtyard from 11 a.m. to 1 p.m., there's going to be an event. And the good news about that event occurring on the college campus is it's an opportunity to have the conversation with young people. Because, we grow up, we're at home, we're adhering to our parents' guidelines as far as when we're younger people in high school or even younger. But when we go to college, we're an adult now, so we figure we're grown and can start indulging in activities that we had not been engaging in. So I think it's a great idea that they're having that event there. And then there's also, and I'm going to read it because it's long. It said, in commemoration of National Black HIV/AIDS Awareness Day and Black History Month, the Region 4 Prevention Through Active Community Engagement, or PACE program, in collaboration with the Southeast AIDS Education and Training Center, present a regional virtual youth HIV summit to share best practices and innovations in youth HIV outreach programs for students at historically Black colleges and universities in the South. And some of the universities that are featured are Voorhees College, North Carolina A&T, Stillman College, Morehouse College, Dr. Kane, that's Dr. Kane's school, and Jackson State University. So
that's not the
we
Kane other school, but go ahead.
and so we will, that's going to be February 15th from 12 to 1:30 p.m. And we'll make sure that we post the link to that on our website, pauseforthetruth.com. So I think it's always a good idea to have a day or a time of the month to remind people, as we're doing on this podcast tonight, that HIV is real. Again, I also am happy to hear that there's going to be conversations with younger people.
Let me chime in, Miss King, Miss King. Let me chime in, Miss Turner. Um, and hopefully I hear it in all of my previous schools, FAMU, where I started, and as well as Morehouse School of Medicine and Morehouse College in that area. I hope that occurs with all, but I want to make sure that parents that are on this broadcast, that are listening to this broadcast, that they have a conversation with their children. Okay. Because they're 18 and considered adults, I know what happened on college campuses. I know what I did on college campuses. And, I know a lot of the young folks think that we're old goats, old geezers, whatever, and not aware what they do. But history tends to repeat itself. So I don't think they're probably doing anything more than what we were doing as it relates to an overall approach to social life and so on and so on, other than having the social media available. Parents need to have this conversation as well with their kids as they begin to go off to college. I really want them to think of, talk to their kids about it. And as someone said early in the broadcast, if you're afraid to have a conversation about sex, then maybe you shouldn't have it. So if you're talking to your parents and you're embarrassed about having these conversations about sex, then maybe you should not have it. And then the parents need to make sure that they make their alert their children as to what's available out there in terms of, hopefully we can educate them enough about PrEP and all the other the other tools in our toolbox to help your child not become a statistic of HIV. I used to say way early on to have, I'd rather have a grandbaby than a dead baby. And so I really want them to be aware of what's out there. I got 5 girls. Be ready. I got 5 girls. And every last one of them that went off to college gave them a bag of condoms. And, of course, they're looking at me like, what? It's like, look, I hope if you come back that if every last one of these are still there, it's because you did not need them. And if you had sex, you needed them. Okay. And I'm not going to think any less of you because you use them. As a matter of fact, I'm going to be very happy that you use them every time that you had sex. I'm not advocating you to have sex, but if you do, please protect yourself from this devastating disease, and me from having to deal with this devastating disease as you deal with it. I digress.
That's actually where I was going, Dr. Kane. I was going to ask Dr. Russ to, kind of talk about it. I know you can't disclose or divulge any of your patients, but you mentioned already at the beginning, so I'm not putting anything out there that you hadn't said, that you have diagnosed people who were born in their 20s. So let's talk about that. Do you have you seen a shift or change in the ages of people who are testing positive, or even with the gender? Are there more females than males, or is it pretty much has been steady over the years?
So I will say this in terms of the ages of people that are diagnosed, it's all ages. At my facility, we treat 18 and up. You have, teenagers, you have people in their 20s that are living their best life. You have people that may have been married for 30 years. They've gotten divorced. They now have a new partner. When they were last single, the only thing they had to worry about was pregnancy. That's no longer a concern. What I will say that I have noticed is that the attitude towards the virus is different amongst different age groups. I always say I can kind of tell if a patient is 40 or over and newly diagnosed, they think it's a death sentence. If they are 25 and younger, they're like, let me take my medicine and go on my way. And then if they're in their late 20s or early or 30s, it might be a mix of how they respond. In terms of gender, our clinic mainly serves male clients. I'd say it's probably a 70-30 split between male and female.
So what about conversations with Rod? Did you have a comment on that?
Yeah, I just wanted to add that in Duval County in 2019, the latest numbers we have, the highest age group was 20 to 29. And that's just in our county alone. So that shows you that younger, and again, just like Dr. Russ says, the attitude is different because it's like, all I gotta do is take some medicine, I'm all right. That is the attitude. And those that are older Older people tend to be a little more. They still have this mindset that this is a death sentence because they don't know the difference between HIV and AIDS. And in this day and time, with all the tools in our arsenal, you can be HIV positive and never get AIDS. And that's what we're hoping. But when you see the young people still with this attitude, because we're all young, we know that we think youth is invincible. Unfortunately, we get wiser as we get older. Too bad we can't be older like me. I'm getting younger as I'm getting younger every year instead of older. So, but if you had that wisdom as a youth, the wisdom that we have now would make a big difference. But they don't see people dying like we did in the early 80s. So they don't see it as that death sentence anymore. And they just know, hey, there's something to keep me alive. And that's the bad part. And I also wanted to add that parents, when we get back to the youth, one of the problems I had with health educating is that I had parents that wanted me to talk to their children. And I have a granddaughter at North Carolina A&M. My thing as a parent is that if you let your children know that you've done something, you'd be surprised. They're more apt to listen to you. But if they think, well, you don't know nothing, then they don't want to talk to you. So even but my grandkids, Dr. Kane said that he has 5 daughters. I have 2 daughters. Okay. And I have 5 grandchildren, 3 granddaughters, 2 grandsons. And so I have a conversation with them often. And I love the fact that they will call. My grandson called me today and said, I need more condoms. So I love that fact we have those conversations and I don't get on them about not having sex because my thing is I try to educate them to the fact that I'm not telling you to have sex, but I want you to be prepared in case you're in a situation. You'll know how to protect yourself. So I think if we arm our kids, even as parents, if we don't know how to talk to our kids, we need to find someone that we trust that can talk to them. And, just give them the facts so that they can make informed, some informed decisions. And I think that may help reduce the numbers among our youth.
Let me just say this, make sure. First thing is, Rod, is making sure that your grandson or granddaughter that went to North Carolina.
My granddaughter's at North Carolina.
North Carolina. Granddaughter. Let's be sure that it's not North Carolina A&T because they're going to beat you up because you said A&M.
I said A&T. It's North Carolina A&T. I'm sorry. Did I say A&M? Thinking about flying you. Someone mentioned FAMU. That's probably stuck in my head. Okay.
Second of all, I just wanted to be. I also wanted to make mention of the fact, one, in my clinic, and I loved it from the health department, that they would give us a bunch of condoms in every room. When a patient walks into my room, there's a big jar of condoms, and
they can get them.
They sometimes ask, "Can I take some of these?" Yeah, take what you need. Use them. Okay, don't take them just to be taking them, but use them. Okay, and so take what you need, and no problem. We're not counting them. We're not looking at what the fact that you took some. I wouldn't know if you took any. I know just by the end of the week, when the jar is empty, I refill it. That's all I know. Okay.
Right.
The last thing that I want to bring up is we've been talking quite a bit about youth. And that was a transitional period. That was a period in time where there was a geriatric population that was the highest number of new HIV cases, that was coming about in Florida for sure. And, that was particularly after the discovery and the freedom of men to use Viagra. They recognize that they got a new lease on life, I guess, so to speak, and they were spreading HIV as much as the young folks were. That has not went away, and not saying that they're still the dominant transmission population that they were at that time. I just don't want them to think that because I'm not one of those young folks that I won't get HIV. Don't have to be concerned about it. As well as, the whole sugar daddy approach. You have to make sure that, you're not one of those people that are facilitating the transmission of this disease.
Amen.
Yeah, and I also want people to know that there are a lot of nonprofits out there working to help educate the public about
Yes, sir.
how to talk to your children, for instance, how to protect yourselves. As Dr. Russ mentioned earlier, there are a lot of older people who've been married for years, and for
Mhm.
whatever reason they divorced or either their spouse passed, and now they're back on the dating scene. So
Mhm.
they're not quite sure how to navigate this whole dating scene. And so, having the don't want to go to a friend to talk about this. So there are places around town that you can call and talk to. I know I worked at the Florida Department of Health here in Duval County, so I know the health department is a resource. The AIDS Healthcare Foundation, did I get it right, Dr. Russ? The AIDS Healthcare Foundation is a resource. Rod, can you help me out and think about other places or organizations, nonprofits in Jacksonville that can help?
There, absolutely. There is Gateway Community Service having HIV. You have River Region has an HIV component. There is Appel Health. There is oh God, Crossroads Clinics. There are a number. We have and there's a large list of places that are doing great community work with great educators all around the city. Um, there's so many.
It's
There's Hope Across the Globe. There's so, there's so many. We can make a list and put them up. I just wanted to add on to something that Dr. Kane said. One of the problems, even with our seniors, one of the problems was that even they're out there in the dating game again. But one of the problems where our seniors that were getting infected is because doctors haven't been asking the question. We found that out, in the villages, because there's this perception that people over a certain age don't have sex, which now that I'm old, I realize that's a lie.
I thought
Okay.
you were
Yeah, yeah,
asexual.
yeah, yeah.
So I don't know at what age
And
sex stops.
Viagra. Don't forget Viagra,
That's
the
right.
Viagra effect.
Viagra, Cialis, Caledra, there's so much out there. So of course but we have doctors that are not asking the right question and not doing a risk assessment, a sexual
There you go.
health
Risk
assessment.
assessment. That's good.
Yeah. And that's something that we need to do. And I think we need to change. When I talk to individuals, young and old, I try to ask them how, try to give them some information on how to talk to their doctors. Because if the doctors are not asking the questions, you need to be asking the doctors the question.
Right. Or
Because if
getting
we're
a
not
new
doing that,
doctor.
I'll get a new doctor. Absolutely.
Do doctors
Absolutely.
typically test you for STDs, including HIV, or do you have to ask?
Well, you know what? In the state of
Yeah.
Florida, it's supposed to be, it's supposed to be the law that if you're being tested, if blood is being drawn, you should be tested, okay? Or you should be offered at least.
There you
But
go.
is it being done? It's not always being done. It's not being done the way it should. But the law says one thing, but of course, you haven't broken the law until you get caught. So, but the law says one thing. But
Well,
it should be. Dr.
let,
King,
let
go.
me let me just move that out a little bit. Physicians that are on this line should just they're in the room with a patient.
Mhm.
It's I tell my patients, this room is like Las Vegas. What happens in this room,
Yeah,
what's
room
said in this
stays.
room,
Yeah,
stays in this room. But I still have those frank discussions with them. If they
right.
want to ignore those discussions, I can sleep at night because I brought it up to them. Okay.
Absolutely.
And
Mhm.
I think physicians, it's their duty, it's their responsibility to address any potential health hazard a patient may have. Okay. And if they just address it and wait for the patient may say, I don't want to talk about that, then fine. It is what it is. I still may come back and reiterate my
Mhm.
concern or my concerns for a discussion later. But you're not being a good physician. You're not being
Mhm.
a good steward of having a medical degree and license to help your community if you don't at
Amen.
least inquire as to what I can do to
Right.
help. Okay.
Absolutely.
Bottom line. Before we get off, I gotta ask you guys this, and I'm sorry to cut anybody off if but there is a new program out there in terms of ending HIV.
Ending
And
the epidemic. Mhm.
okay, the epidemic, ending the HIV epidemic. Anybody want to talk about that? And go ahead and feel free to say what you know and want to. People to know.
Yeah, ending the epidemic is a 2020 campaign promise. We to end the epidemic and HIV. In the state of Florida, we are doing a great deal. Every county in the state of Florida has some kind of protocol. We are funded to. First of all, in the state of Florida, we have 7 major areas where HIV is highly impacted. Duval happens to be one of them. We've got Miami-Dade. We got Pinellas County, Orange County, West Palm. What am I missing?
Hillsborough.
What about the Tallahassee area?
Well, no, the Panhandle is not in that scope, but there is funding in the county health departments and local organizations. We want the community, the state, the nation wants the community to take control of finding ways that's best suited in their community to help end the epidemic. There's money out there for special program for hard hit populations. There are the health departments, there are community-based organizations that are working towards ending the epidemic. Duval County has a task force that's working with the EHE. And it's a national push. And I'm not thinking, my brain went crazy for a second. Dr. Russ,
add to it.
Yeah.
And Dr. Russ, you may be able to add to it. But I'm thinking Dade, which is Miami. Broward,
yeah, Miami-Dade.
Fort Lauderdale.
Miami-Dade, right.
Pinellas, which is St. Petersburg. The other one, Tampa. And obviously Duval. That's 5 that I and Orange County is Orlando. So
and then I think Broward as well.
Yeah, I thought I said Broward, but that's Fort Lauderdale.
Yeah.
I just wanted to say that some of those goals are, it was a 90-90-90 push by 2020, and now it's 95-95-95 by 2030, which represents 95% of 95% of people living with HIV knowing their status, 95% of people that have a diagnosis being in care, and 95% of people being in care being virally suppressed by the year 2030, which is why testing is so important, access is so important. It all works hand in hand in keeping the community safe.
So the goal, if not to restate it, is maybe 75% of the people by the year 2025. That there's a decrease in 75% of HIV cases by the year 2025, and then a decrease in the number of cases by
90% by
2030. Right. Okay. And that's important to know that it's out there, and that's why I just wanted to make sure we bring that up in this broadcast.
Let me hit those counties again. It was Broward, Duval, Hillsborough, Miami-Dade, Orange, Palm Beach, and Pinellas. Those are the counties.
So on that note, I think we've answered the question as Dr. Russ has somebody photobombing her behind her. The joy of being a mommy, right? But so I think
that reminds me of that broadcast where the guy from England, where the kids came in.
But that's the answer. The question is: HIV still affecting our community? Yes, HIV is still affecting our community. We learned a lot from our guests tonight, and we, as usual, as we near the end of the show, because it's clear that Dr. Russ has to get back to her family, and we really appreciate your taking your time out, Dr. Russ and Rod, to join the discussion tonight. But we always like to end the show by asking our guests to share their final thoughts. Dr. Russ, I'm going to go ahead and start with you. And if you have any events coming up, I know, Rod, you have an event that comes up that you plan every year. So Dr. Russ, I'll start with you.
Okay, I'm actually going to start kind of in reverse. So we mentioned there's a difference between AIDS and HIV, but I don't know if we actually said what that difference was. So HIV stands for human immunodeficiency virus. That's the virus that we're talking about that we measure. AIDS is acquired immunodeficiency syndrome, which is a constellation of symptoms, some diseases that you may only see, such as Kaposi sarcoma or certain types of pneumonia, or a CD4 count of less than 200, which means your immune system is impaired. I just wanted to make sure that we actually touched on that tonight. But I want to say HIV is a chronic disease. If you get it treated, we now have a once a month shot called Cabenuva for treatment. People don't even have to take pills every day. So there are so many options, but we can't get you the options unless you know your status. So get tested, get tested, get tested. AHF does testing Wednesdays and Saturdays on the ninth floor of St. Vincent's, as well as we have a mobile unit that goes out around the town, and you might just see them pop up and just get tested.
And Dr. Russ, if you know, we all know that you're a great doctor providing good medical care with AHF, but is there, and we'll make sure that we post AHF's phone number on our website so that people do need care, who know their status and know that if they have been diagnosed, that they can come to AHF and have you as their clinician. So we want to make sure that we also know that, because we know you've been doing wonderful things talking to your patients, and we really appreciate your knowledge tonight. Rod, I know you used to work at the health department. We have that history, but if you're anything like me, and I know you are, you're still active in the community in terms of doing things. And I know back in the day, you used to organize an annual event, Umoja, or what was it called?
Ujima.
Eugenia.
Well, yeah, the Ujima. In fact, Dr. Russ and I did an Eugenia down in Tampa. It's been a while. I haven't seen you since then, by the way. But yeah, the
What are your
Ujima.
final thoughts, Rod?
Ujima is one of the principles of Kwanzaa. It's the collective. And what we do is, and there is a national Ujima Men's Collective conference that's held down in South Florida in the West Palm Beach, West Palm, Fort Lauderdale area annually. But we do a one-day Ujima around the state in different territories. We did Tampa, we did St. Pete. We just did the one in St. Pete. We have one coming in Jacksonville on April 9th, April 12th, or April 9th of this year. So we're still working on putting it together, but it will be at the Beaver Enterprise Center, Saturday, April 9th. And we want everybody to come out. But just one quick thing is that, first of all, everyone should know their status and everyone should be educated. And the only dumb question is the one you don't ask. So if there's a question, you young or old, if there's a question you're not sure about, go to a trusted source. Go to the Department of Health, go to the Department of Health's website, go to the CDC website, the National Institutes of Health. There are a number of places where you can get concrete information, solid source fact-based information on HIV. And again, it is still affecting our community as people of color. It's affecting the state of Florida because we're still in the top 10, and Duval County is still in the top 10 and top 5 in the state. So we need to protect ourselves, get tested, and educate. And I'm often asked, how early do you start talking to your child? When your child asks you a question, no matter what age, that's when you begin education.
Thank you, Rod. And thank you also, Dr. Russ. Dr. Kane, do you have any final thoughts?
Well, yeah, I just want one thing. First thing is a listener did ask, do you have to pay for these services? So we did not discuss any finances or anything. Anybody got an opportunity? Can add to that part of the discussion. We got enough time to hear that.
I think that was directed to Dr. Russ.
Mm-hmm.
Absolutely. So AHF does take private insurance, but then we also work with different community programs, most famously known as the Ryan White program and AIDS Drug Assistance Program, which are through the government. Our motto is care without the inability to pay. So we want people to come in and we'll figure out everything else after the fact. So the main thing is getting care and we'll sort through it together.
Got it. Okay.
Thank you.
So my final thoughts, because I want to respect everybody's time, including Dr. Russ's boss, Dr. Russ's boss. I spent so much time lately on the COVID virus. Mm-hmm. It's one of those things that we can do some things to protect ourselves, but not as much as we can do to protect ourselves from HIV. Okay, mm-hmm. Because it's a contact disease, more or less. And you can prevent, if you stop any contact, no disease. but there is still some level of, for lack of better description, equilibrium, and some level of balance that you have to reach within life, that you may have these contacts. All I'm saying is being smart about that contact. Know what your options are. Know what your status is. Know who you can go to talk about either your status, testing for it, or if you have already become positive, discussion with people as to what you can do to help yourself to survive this disease, and also help prevent you from passing this disease on to others. This is a very manageable disease at this point in time. There was a time, because when we didn't know, it was not as manageable. Now, I'm not saying everybody can go out there and be willy-nilly about what they do, but be very responsible to what you do and responsive to people that may need your assistance. I'm especially talking to physicians that may need your assistance in navigating their people's lives and through HIV, and not obtaining disease, as well as dealing with the disease if you have contracted it already. And that we are, as an organization, in terms of the Pause for the Truth, we're committed to helping the community from all aspects of being as disease-free and or manageable as possible. And we have not forgotten HIV, because it has killed a lot of people, and is so preventative these days. Is much better than what it was. And to give kudos to our guest panelist, Magic Johnson, because of the role that he has played long term. If it wasn't for Magic being that first person, being the face of HIV, I don't know what would have happened to the Black community. I got a whole different story to talk about that, but that's stuff on the side that we can talk about, because of personal contact and information on that issue. I just want everyone to stay safe, practice safe sex, feel free to discuss HIV and STDs, period, with your physician. Hepatitis C is out there.
Chlamydia is out there, gonorrhea.
This is on the rise. It has been on the rise in the past. It is not a forgotten disease. So just be cautious with what you do. Think about what you do. Think about yourself and others with what you do. And that if you need any information, we plan on making sure that our website can help provide it. But and that's because people like organizations like what our guest represent to you, and all we want to do is make sure we put you in contact with those organizations. And with that, I'd like to say thank you to our guest panelists. You guys have been excellent. Apologize to your boss for me holding you over beyond the time we advised him to keep you. And so thank you guys.
Thank you.
Thank you so much. Be safe, everyone.
So thank you. Before you leave off, though, so thank you to our listeners for engaging in the conversation with us tonight, and remembering that HIV is not the only virus out there that we need to be concerned with. We also need to make sure that we continue to practice CDC guidelines relative to avoiding your risk for contracting COVID-19.
And it can coexist.
I was talking to a friend recently who said that they know someone who died recently of the Delta variant strain of COVID-19. So it is still out there. And so we can't just think that because the Omicron variant is the dominant strain right now, and I'll just develop flu-like symptoms. The Delta variant is still out there. People are still dying from COVID-19. As you heard from the discussion tonight, people are still getting infected with HIV. The bottom line when it comes to viruses, don't try to be a scientist. Don't try to be a physician. Trust trust your physician, your scientist, as you always have in managing your diabetes, your high blood pressure, and other diseases that you deal with on a day-to-day basis. It's Heart Health Month, everybody. Can't forget to push that out there. Join the discussion next week as we talk about heart health so that we can always also know how to reduce our risk of the leading cause of death in the United States,
Mhm.
in Florida, in Duval County, and that is heart disease.
And if you don't trust your physician, get a new one.
Amen.
Good evening, everyone, and thank you for listening to pauseforthetruth.com. And thank you to our behind the scenes technology expert, Tyrone Jackson. Just call Tyrone.net. Good night,
Call
everybody.
Tyrone.
Good night.